Hey, good morning, everyone, and welcome to UroNurse. I'm your host, Vic Sinise. Glad to have you on the show. We come to you every Saturday at 9 a.m. Central Time on all of these different platforms. Be sure to like and subscribe to our YouTube and Facebook channels and everything else that you're watching us on. If you're new to the show, be sure to go to our website at uronurse.com to learn more about the show. Best place to get more information on some of our other great podcasts, visit our sponsors. And it's the best place to go and watch all of our past episodes. Every episode is on our website. You can get a quick link over to those. A lot of you have told us you like to listen in the car. I'm amazed at how many people are listening to our audio podcast. I created a channel just for that. We've got our audio version of the show available. It comes out about a half hour after the show, and it'll be available on any of your favorite podcasting apps. So be sure to check that out. So this week, we've got a great show for you. We have the group from Convatec joining us. I'm going to talk to you about how to protect that urethra and reduce the risk of urinary tract infections for your patients. So let's go ahead and bring on our experts right now. Welcome to the show, everybody. How are you doing today?
Great, thanks.
Doing great, Vic.
Hey, Vic.
I'm going to have everybody do an introduction. I'll start off for those that might be new to the show. I'm Vic Sinise. I'm the creator, host, and producer of UroNurse. I've been doing this for almost two and a half, almost 3 years now. Been involved in urology for the last 40 years and just love giving back over this platform. So I'm going to bring in the rest of the group here to give their introductions. Megan, why don't you tell us who you are and what you're doing for Convatec?
Yeah, thanks, Vic. So my name's Megan Chintala. I'm Senior Marketing Development Specialist for U.S. Continence Care. I've been with the organization for 2 years.
Oh, great. And Danny, go ahead and give us your introduction.
Hi, how's it going? I'm Danny Williamson. I'll make 11 years on Monday with Convatec. I'm a regional manager, so my team is everything east of Texas. Our job is to educate and consult with nurses on, how they can get their hands on our products and how they can, in turn, help their patients.
Great. And Dr. Ali, you're up.
Hi, yeah, my name's Ased Ali. I'm the medical director for Continence Care at Convatec. I'm also a doctor, and before joining Convatec, I used to work as a full-time urologist with interest in urology and spinal injuries. I still work part-time in the UK National Health Service as well as working at Convatec.
Great. And with that, let's go ahead and bring up the show, and we'll go ahead and bring that up now for you. Go ahead.
Great, thanks, Vic. So, as I say, thank you for having me on. And today, the topic area we're going to be talking about is protecting the urethra to reduce the risk of UTI. I'm going to talk about some of the challenges and possible new technologies that are around to help us. So just quickly, disclaimers, the opinions here that we're expressing are our own. And just quick of the disclosures. And then moving on to the actual talk. So let's start by talking about some of the issues of intermittent catheterization. And so what are the risks of intermittent catheterization? Well, first of all, we've got the sort of potential pain and discomfort that you get. Typical users will need to have to do this about 4 to 6 times a day, which is a fair amount of times. And then we've got the increased risk of infection. Most patients suffer a UTI at some point, and sadly, many will go on to suffer multiple UTIs, especially those who are maybe doing this for a neuropathic bladder, like those who've got MS or a spinal cord injury. But even those who are doing it for just enlarged prostate will still quite frequently have problems with UTIs. And then we've got this issue with the trauma to the urethra. So we often call this micro trauma because it's small amounts of regular damage to the urethra, which makes it more inflamed and sensitive. And patients will often say that there's got a sort of general level of discomfort. You can also get scarring, which then causes a narrowing in the urethra and i.e. a stricture. And I also mentioned micro trauma before, but as well as that, you can get more significant macro trauma, which can cause tears or bleeding. Thankfully, that's a little less common, but can still occur. So to try and address these challenges, there's been some developments in catheters over the years. We started off originally with the first generation of catheters, which were uncoated, and typically latex, silicone, PVC, and you had to add lube on separately, and that would be uneven in terms of how it was put on, and might not get all the way down to the urethra. It was also awkward, to be honest, to putting that on, separately. So then we got a second generation of catheters in 1980s, and at the time that was pretty big innovation, and it was actually WellSpec that came up with these hydrophilic catheters. And what they did was they coated the catheter with something called polyvinyl pyrrolidine, which is PVP. Based coating, and this was hydrophilic, and what that means is that when it gets wet, it gets slippery. It tracks water and it gets slippery. This is quite a significant step because you didn't have to apply lube manually. It was evenly spread, and it became the standard of care in a lot of countries. However, it still had one issue, and that is that as it dries out, it becomes sticky, and that's because this PVP stuff, it's got these adhesive qualities. I mean, literally, the coating is stuck onto the catheter separately, and this still has adhesive qualities, and as it dries out, the coating itself becomes sticky, and therefore the longer you take to catheterize, the more sticky it gets. PVP, actually, believe it or not, is actually the same component that you find in certain glues, actually, so it's not surprising that does happen as it dries out. So to address this, Convatec developed a novel catheter material which has hydrophilic lubrication built in. Its technical name is integrated amphiphilic surfactant, or IIS, but what we call it is FeelClean Technology. And the key thing here is that it doesn't have there is no coating. It isn't coated on. It's built into the catheter. The whole material of the catheter has this slippery property, and it gets activated with water, but it doesn't get sticky as it dries out. So what I'd like to do is take you through some of the evidence that Queen's University Belfast, who we collaborated with, have presented on why this new technology helps address some of the issues that I described earlier. What's the next slide? So in order to really examine the effects of the catheter, what they did, first of all, is develop this model and used to be called a biomimetic model, which actually uses human urethral cells. These are cells, these are human cells from urothelium, the lining of the bladder and the urethra and the ureters, and grew them out on a layer to try and mimic the lining of the urethra. And then they used a special machine that actually drags the catheter across this urothelial layer to mimic what happens when you're moving a catheter across. And they did this initially at 0 minutes to insertion, and then did it again at 2 minutes to mimic what would happen after you've left the catheter in for a while and then you move it across. And so they did this with a variety of different brands and types of catheter, and you can see that at the top we've got the uncoated catheter, and that's as a control. So that was just to see what's the kind of the worst case scenario if you weren't using anything. And then below that we've got the IIS, this integrated amphiphilic surfactant catheter, the FeelClean Technology one. And then we've got a variety of other brands of PVP coated catheters, and you can see there's 4 different ones there, including one with micro holes as well. And they did this test where they put it across the over the cells to mimic the insertion and removal, and then examined what the cells look like afterwards. And they got 25 PhD students to do that. And the reason they did that was to try and remove the kind of observer, bias or some sort of, inaccuracy, because you might get sort of slight differences. And by having a large number of people all putting it in and putting that and averaging that out, that gave you the sort of most reliable data. And what you can see there is that on insertion, actually, other than the uncoated catheter, which does pretty badly, as you might expect, most of the catheters do pretty well, with only mild damage. Actually, the IS catheter only has slight damage, but overall, things are not too bad. But then we look at where things are at 2 minutes later. So this, you try and mimic, the catheter's been in, you've drained the urine, and now you're taking out. And you begin to see a pretty different picture. At this point, you're starting to get most of the catheters causing moderate degrees of damage. Only the IIS catheter only causes mild. And this you can see on the pictures to the side there. The same thing that you can see at the top what urothelium looks like when nothing has happened, and then you can see on those other catheters what's happening with the damage to the cells. You've got various kind of essentially empty areas where you haven't got any cells anymore. And this was sort of the first indicator of how that stickiness that we were describing from PVP can manifest. So, okay, that was pretty interesting, but that showed what's going on at a sort of a cellular level. What they really wanted to then do was see, well, how does that actually work out on an actual urethra? And urethra is a sort of circular structure. What is it going to look like on a real urethra? Now, for obvious reasons, you can't do that in a human being. I don't think that would be ethical. So what they did was the next best thing, which was look at pig urethras. And they developed this model using pig urethras, where they take a piece of pig urethra, put it into a special tube and fix it in place. And again, they did their insertion and withdrawal of the catheter. And what they were to see there again was that the IIS catheter had the least withdrawal force. But what was really interesting, and maybe even a little bit unexpected, although not when you begin to understand it better, was the fact that some of the PVP hydrophilic catheters, other than the IIS catheter, actually had worse withdrawal forces, or more withdrawal force required than even the uncoated catheter. And what this is due to is, again, this is that stickiness beginning to manifest, that as you're withdrawing, it is actually more sticky. So even an uncoated catheter seems to actually, on withdrawal, seems to do actually slightly better in terms of the force of withdrawal. And obviously the IIS, which maintains its slipperiness, continues to do well. And you can see that on the graphs there. So as well as looking at that, at the force of removal, the other thing they wanted to look at is, because they noticed when they were doing this, is that there was that it looked like some of the coating was coming off. So what they did next was they dipped the catheter into a special dye, into a blue dye, and you can see on the left-hand side that you've got the pictures of the catheter with the dye. Now, obviously, because the uncoated and the IIS catheter, they don't have this sort of PVP coating. They don't. You can't see the dye on those. They don't absorb it in the same way. But the PVP catheters, they're all got dyed. But what you can see on those, and it's indicated with those red circles, is that after they'd been removed, there were kind of bits that seem to be missing, and we call this delamination. So the actual coating itself, some of it you're beginning to lose. And then when you look at the urethra and you open up the urethras, this is those pig urethras, and the inside of a pig urethra is very similar to the inside of a human urethra. You can see that you can see these little bits of residue from the catheters to varying degrees over there. And so this is like a pretty fascinating finding, and it does go, it does make you start to think about, PVP coated catheters in general. Now, we know this was just a one-off with one insertion, one withdrawal, but in reality, catheter users are doing this 4 to 6 times every day. So multiple times, that's quite a significant number of times. And we know that what we've seen from those experiences that you are getting a degree of trauma, and you've seen more trauma with these PVP-coated catheters. They're doing more damage to the cells. More cells are being lost. We're also seeing these residues that are being left behind, and you can see those quite clearly on the urethra. These little blue bits. But on top of that, when you add it altogether, you also know that the whole reason why people catheterize is because they can't pee, and therefore they don't have the flushing effect of pee. So whatever's these bits and pieces are, and whatever there's a good chance that over time they're actually sticking around. They're getting cured, because what's going to get rid of them? The only thing that's going to push them is another catheter, maybe. Otherwise they're sticking there, and they're over time. There's no urine to flush them. So this brings then some other interesting questions, which is, what could be the impact of those bits of residue that are left? Could it be affecting wound healing? Because we know we're getting this microtrauma. Every catheter causes some degree of microtrauma, some more than others. But could having bits knocking around in the urethra, could it have an impact on that healing? What about on infection risk? Now, this is essentially a small bit of a foreign body. This is not a natural component. This is there. Could this be having any effect on people's susceptibility to infection? We know that the water pipe, the lining of the water pipe, the urethra, as cells form a kind of a barrier to infection. But if you've got all of these bits that are knocking around, could those act like a nidus for infection? Could bacteria hide in that? Could they stick to that? So that's another area that needs further investigation. And then finally, the most intriguing one is in relation to sort of fertility. Now, we know that PVP has actually traditionally been used as an agent within fertility. And so when sperm is collected and you've got the egg from the mother, and then they're injecting the egg with the sperms, and this is something called intracytoplasmic sperm injection, ICSI. One of the ways that they stop the sperm wriggling around is by using PVP. So PVP does reduce the mobility of sperm, and they actually use that in that sort of treatment. However, it also seems to have some detrimental effects on the sperm, such that some places are now using other agents rather than PVP. But again, it brings up this question: is that if this residue has got PVP and it's accumulating in the urethra, could that also have effects on sperm? And we already know that neuropathic patients, particularly those with spinal injuries or MS, can already have issues with fertility. And so just bring a question is, could this also be contributing to that? So I think there's a lot more study that needs to be done in this area. But I think the key thing is that irrespective of what the ultimate adverse effects of the coating is or isn't, we now have another option that doesn't have that. And that's where this new technology in terms of integrated amphiphilic surfactant, this FeelClean technology, I think really offers some benefits. So to summarize, the urethra is delicate and it plays an important function as a barrier to infections. It's important that the catheter is gentle and it does as little harm as possible. FeelClean technology incorporates hydrophilic properties, so it's getting the best of those second generation. It's got that hydrophilic slipperiness. However, you don't get the stickiness, you don't get the tugging, you don't get the mess that you would see with PVP coating. And ultimately, the aim of this is to reduce discomfort, bleeding, and the risk of UTI. So that's why at Convatec, we're excited about this technology and how this can help patients going forward. The original hydrophilics were from the 1980s. That's over 40 years ago. It's time that we had some innovation in this area, and hopefully, this is going to help in that direction. So I'm now going to hand over to my colleague Danny Williamson, who's going to tell you a little bit about the products that incorporate this great technology. Thanks.
Thank you, Doctor. Let's see. All right, so we'll definitely go over some of our newest products that take advantage of this FeelClean technology, this innovation. Our newest product we just debuted at SUNA in Orlando last year, Gentle catheter for women. All right, so this is the Gentle catheter for women. It's our first discrete female product to take advantage of our FeelClean technology. What I love about this is that we've taken our years of patient interaction, of interactions with healthcare providers, and we made our design choices based off of real life issues. And first thing you'll notice is that the chassis, or what we call the air case of the cath, it's discreet. It does not look like a medical product. And that just falls in line with our sole mission of making sure patients, they get that gentle protection they deserve and they expect from FeelClean, but they'll have that confident living of being able to go out and about, live their life as normal as possible without worry about any type of awkwardness or embarrassment should anything happen. So the air case is designed for discretion in mind, but also functionality as well. Speaking to patients over the last few years, especially my female cath patients, sometimes when they're going into stalls or whatnot, they do run into issues if they're cathing in public. sometimes they'll tell me, Danny, I feels like I need a third hand when I'm, handling my catheter in one hand, handling my lubricant pack in the other. Or if they're using another discrete package, it's almost like they're trying to dodge water or whatnot to making sure they're not getting their garment stained to go back to work. So what I love about the air case is that it's got that patented design. There's a water chamber on the inside that provides instant activation for this cath, but no drip if you were to turn it upside down. Also do love the fact that it does have an attachable top that can actually serve as a base. So the patient doesn't have a need for a third hand, right? They'll be able to handle the cath without, there being separate pieces that they'll have to worry about keeping track of. And everyone these days are a little bit more mindful about their impact on the environment. And we definitely took that into consideration. The air case itself is 100% recyclable. If they do want to utilize this while they are at home, they can just dispose of the cath itself on the side. It's been making a great impact. I'm glad that it's one of the only discrete catheters out there that doesn't make a sacrifice in length. It's got a full-size funnel, and for that confident handling. It's been phenomenal when it's coming when it comes to changing what females think about cathing. We'll move on to the next one. The GenoCath Air for men, as you can tell, our GenoCath Air product line is all about that confident living, all about being active out and about. Sometimes the concerns patients mention when they're learning how to, self-catheterize or to adjust to this new way of emptying their bladder is, can they continue to live their life as normally as possible? Can they continue to go bowling? Can they continue to go meet up with their friends? They don't have to live life as a recluse. And this just falls in line with that. First thing you'll notice, looks nothing like a catheter. We're continuing to have to develop more discreet, more functional packaging. What I love about the GenoCath Air for men is that it is resealable, this opaque packaging. So if a gentleman does need to catheterize away from home, they don't have a proper way of disposing their supplies, or if they want just a little bit more discretion when they do so, they can self-catheterize, take advantage of the FeelClean technology and the protection it provides, but be able to dispose it with confidence and that they can expect, dealing with Convatec. One thing I also love about this, and you guys will notice, is that it is available in everywhere from 8 French up to 18 French. I know we have some pediatric clients who self-catheterize, and unfortunately, younger kids can be cruel at times. And so this gives them that discretion, that extra protection from embarrassing moments or otherwise, ostracizing situations. Also, you notice that discrete packaging tends to be a trend in this industry. But those patients who don't suffer from any type of prostate obstructions, any kind of BPH, their options are pretty limited when it comes to discrete catheters. We want this to be available for everyone, so we manufacture the GenoCath Air for men in a straight tip as well. It's possibly one of the only hydrophilic discrete catheters available in that A4351 code for here in America. What that means for healthcare providers is easily you can prescribe this with confidence without any extra pushback from a DME provider about addendums, chart notes, etc. Any patient should be able to get their hands on a GenoCath Air for men. Then finally, we have the catheter that started it all. This is the GenoCath Glide. This was our first generation of FeelClean technology. Just a kind of an anecdote. When I first had experience with this catheter, they brought over the prototypes, were from Europe. And I remember some of my first comments was, "Where's the coating? Where's the coating?" I was just so used to being able to take my fingernail and rub the coating off and assess, how lubricious a catheter could be. Little did I know that was the whole point of these prototypes. And this was the first one we rolled out here in the United States, and it's made a big splash on the market. First thing you'll notice, it does have more traditional catheter fill. So it's easy adoption for patients who have used, other models in the past. This is very familiar for them. But we did make some design choices. You'll notice it does have a mesh gripper on both the male and female versions. The gripper is typically the same length or the same width as a fist. So now it enables the patient to handle the catheter, again, with the confidence necessary, without worrying about, accidentally exposing, to on foreign bacteria that might be on their hands or whatnot. One thing I really love as well is that is available in 8 French all the way to 18 French. Protecting urethra is important, especially when it comes into the smaller French sizes, those 8 Frenches, those 10 Frenches. The majority of the time, people utilizing those French sizes are in the pediatric realm, and they're being catheterized by their parents. And in several cases, those same pediatric patients can't verbalize what they're feeling. So for parents, providing that peace of mind of knowing that they're being gentle for their loved ones, gentle on their urethra, is of the utmost importance. And so that's why I'm glad that we've got the FeelClean technology in just about every French size available, starting here with the Glide. Also, one thing that I'm very proudful of is that this is available in the VA. Our soldiers have given and sacrificed so much for us here. And the least we can do is provide them with the care, that extra level of protection that they provided for our country. So it is available here in the VA as well. And we'll be more than happy to facilitate anyone getting their hands on this. We'll definitely pass it over to Megan now. She'll be able to share on how to learn more about FeelClean technology.
Yeah, thanks, Danny. I said, if you wouldn't mind going back to the final slide. Thank you. So we welcome you to scan the QR code to learn more about Convatec's product portfolio of GentleCath with FeelClean technology, as well as our Cure product line. You can also sign up to receive our quarterly e-newsletter, Urology Insights, learn more about our Me Plus support program, which provides resources and support for both patients and HCPs. And you can even request complimentary samples for your patients. So please scan the QR code, and we really look forward to connecting with you and your colleagues. Thank you.
Oh, that was really great. Just gonna like to say thanks to all our viewers out there. We got a lot out there. If you have any questions, please put them in the comments section. Annette from New York, welcome to the show. Susie from Centralia, Washington, welcome to the show. Lucy Ann from England, welcome to the show. Bo from Nashville, Tennessee, welcome to the show. And those of you that haven't put in where you're from, go ahead, feel free to put that in too. But any questions that you have, we've got our experts here to answer those questions. I'm going to kick it off with a couple things. I've used the Convatec one before, and I really like is that gripper thing that's on the I don't know about the air if it has. I was going to ask, that was actually my question, is that little gripper to kind of grab and push this, because all of these hydrophilic catheters are so slippery that they're really hard for some patients to grab. And I don't know who wants to address it. Does all the line have the grippers on it for male patients, or?
Yes, sir. The GentleCath Air for men and the GentleCath Glide both have that mesh gripper. And you're right, it does allow patients to have easier handling. But what I also love about it, that it is collapsible. So as they, begin advancing the catheter and they need more real estate, it does collapse on the cath itself to allow them to take full advantage of it. But it is available on both the GentleCath Air line and the GentleCath Glide line.
Good. That was my question, because it's a must. I have to tell you a quick story. So, I mean, I've taught, I can't even count how many patients I've taught how to utilize intermittent catheterization. Always a big fan. Almost every patient that's wearing a long-term catheter, I try to talk into going to intermittent cath. I just think it's a better lifestyle. I've had very few ever say, go ahead, put that Foley back in me. They're really happy once they learn. But my prejudice was always just to use a plain old catheter and lube. And the reason I did that was early on, the other ones I thought were just too slippery, number one. And number two, too messy. And I think that's one of the things that you guys are conquering here, is that messy stuff that's around the catheter that, now, as Dr. Ali was pointing out, actually can come off the catheter and leave a residue inside the urethra. Can you explain a little bit about how yours works differently again, Dr. Ali?
Yeah, so what we have is this integrated amphiphilic surfactant, and I think I don't know if we want to bring back one of the slides. Actually, I can just show you the diagram of that. Oh no, got a little too far. There we go. So what you have is within the material of the catheter, you've got these sort of molecules, and they've got this hydrophilic surface. It's in a way the mechanism by which it creates hydrophilicity, this slipperiness, this attracting the water, is not that different to the PVP. But the critical difference is it's not a coating. It's not been applied separately. It's not been dipped in something that's been applied. It's actually that material itself has got this integrated into it. And that's what makes the key difference. You're getting almost the benefit without that drawback. You're getting the benefits of having the hydrophilic properties, that it is a bit slippery, but without the stickiness. The other thing I will say is because it doesn't come off, it is easier to handle generally, because the other one tends to come out. I think part of the problem that people have, and especially I've seen this in, it's a really great point that you make, Vic, that especially patients who've got spinal injuries and maybe slightly higher spinal injuries with limited dexterity. They've got about enough dexterity to be able to do intermittent cathing, but it's not entirely straightforward for them. For them, having something that just isn't quite so slippery like a little eel or something is really helpful. And I think this IIS technology, FeelClean, really sort of helps with that.
Yeah, that's great point. We do have some comments coming in here. Raj says, "Good morning from Houston, Texas. Glad you decided to tell us where you're from, Raj." Annette Dawes says, "Thank you." And Carol R says, "I have new appreciation for offering good products to our patients." Yeah, I think that definitely this is what the show is here for, so that we can get all these great things that are out there for you guys to learn more about. Now, I'm not sure who wants to handle this one, but I think this is a common question that I've always had is, these catheters are better. Are they more expensive? Are they covered by insurance? Who wants to take that? Is it Danny or? All right.
That'd be me. Convatec, we're vastly experienced in navigating, the United States healthcare market. And so we understand how important it is to make these catheters accessible to people. So we usually negotiate very aggressive pricing with our distribution partners out there. So typically, as long as the patient does have some sort of catheter coverage, they can get their hands on a Convatec catheter. Even those low, I don't want to call out any individual insurance company, but those who are notorious for lower reimbursements, Glide at least will be a go-to for them. And we understand that a patient doesn't go out choosing an insurance based on their catheter coverage itself. That's just something they expect. And so we want to meet those expectations and not have their options limited. So they should be able to get these with no issue.
Yeah. And so how would a patient go about getting the catheters? Is just the doctor chooses at their office, or is there somebody that they contact from your company? What's their best way to, if they said, "Oh, I watched this on YouTube and I really want this catheter to try"?
So we're all of the above. I mean, they definitely can contact a urologist. Our team strives to spread the word and spread the samples, right? We want to make sure these are in every urology clinic in the United States. They can definitely reach out to us. I'm sure that we can repost the QR code, but that'll lead you right to our hub. We've got a team of Me Plus specialists who are on standby, ready to assist patients with any type of sample request, or if they just want to learn a little bit more, we can definitely do that. But generally, anyone in the urology world, work through your urologist. If you are a urologist or you are a healthcare provider and you'd like a sample pack, definitely scan the QR code. Once again, we can facilitate having samples delivered right to your doorstep as early as next week.
Yeah. And you are one of the sponsors for UroNurse, so they can go to our website, and there's a link from our website to your website. So that might get them over to get more information. Susie Swain says, "So no lubricant at all is necessary to add for this catheter. Is it okay for the patient to add lubricant if we want to?" Maybe we'll get Dr.
Yeah, sure.
I'll
So
leave it
the
at.
first thing to say is that it's still got this hydrophilic property. So it still has to have, there's still water added on. So either, as Danny was describing, there are two different, depending on the model of catheter, there are two different ways in which that water is deployed. Either it's through our wetting chamber, like you see in the female product, or it's by a water sachet that's burst. So that's what activates it. But so you are still that's what activates. But the thing that gives the lubricity is built in, but it has to be activated by water. Is it okay to add on additional lubricant? Yeah, I mean, there's no danger in doing that. If you wanted to add some, water-based lubricant, that would be fine. I think I would stick to water-based lubricants. I know there are other types of lubricant, but I think a water-based lubricant. I don't think you want an oil-based one. Like sort of things like Vaseline and things like that. I wouldn't want to use that either. But any sort of water-based lubricant, if you wanted to use that, I don't see that was a problem. But my hope would be that you wouldn't need it because it is integrated in there. The water activates it.
Now, is there like a limited time that you can get this? Once you activate it, does it dry out? Or, I mean, is there a limited time to how soon you have to use it? Or
so, I mean, compared to the PVP catheters, no, because as I say, that is built into the thing. Like anything, though, for something to be hydrophilic, it still has to stay. There has to be some wetness there, not a lot, but some has to still be there. So once it's in, that's it. It's become wet. It's been activated. Once you put it in, you're going to have enough wetness in there, even when you take it out. So it doesn't have that kind of drying out that occurs. But yeah, if you wet it, if you activate it and leave it, I don't know if it's out for 20 minutes or something, then okay, that's something slightly different. But basically, the technology tells you once it's activated, you're using it. You shouldn't have to do anything more.
Yeah. Oh, good. So now the air product, I like the fact it's got that bag that's kind of, nondescript. You really don't know what it looks like. Nobody knows you're carrying a catheter. Let's put it that way. Again, insurances would be able to cover that in most cases. I'm going to ask you that to Danny. Is that going to be an issue?
Yeah, that's correct. That's the reason why we've manufactured it with two different types of tips. I know in the past, traditionally, catheter manufacturers would only make discrete catheters with a coude tip. Here in the United States, typically, for insurances to reimburse for coude tip catheters, they require extra documentation, right? Extra proof that a patient has some type of obstruction. And a lot of times this caused healthcare providers to go and add addendums or whatnot to visit notes. And so we've decided to manufacture both. Straight and coude. So for patients who don't have that issue, there's no kind of extra addendums or chart notes needed. But it's still aggressively priced with our vendors out there to where it should still fit within the fee schedules of both private and public insurances.
Yeah. So that's a good point because that is
it's not
something that we've had to do is we have to make sure we're documenting if we wanted a coude. Now, I can tell you from my own experience, whenever I teach a patient how to catheterize, a male patient I'm referring to, I always start with a straight. And the reason I do that is because some people just get confused because once it's in, I know they have a marking to tell you which is up and which is down, but trust me, patients get confused as up and down. And if you try to put a coude in upside down, it's a disaster. Ooh. So I always start with a straight catheter and see if that's suitable. And then if it's not, they have trouble because of a large prostate. The coude is a perfect thing to use, but at least try to see if you can get a straight one in there first. Any other thoughts that people have about, choice of catheters or any different sizes? Is there a reason? I know they make from 8 to 18. Do you have a reason why you would pick something as large as an 18? Maybe I'll bring up Dr. Ali for that.
Yeah, I think that's a great question. So the advantage, there's always this trade-off, isn't there, between the larger a catheter is, the quicker it'll drain. It'll also drain. In some ways, drain in inverted commas, let's say, better as well, because if you've got debris and things like that, that's more likely to drain out because it's going to come out with a bit more force. So that's the advantage. The bigger the catheter is, but equally, I think we all know that the bigger the catheter is, the more comfortable it can be as well. And so it's that trade-off. And when you go to the really small, but if you go to the really small end, and you have to for younger patients or patients who've got more narrow urethras, the flow is really slow. I mean, it can take ages to catheter. If you're using a size 8, trying to drain 500 mils, you're going to have a fairly long wait on your hands. So I think it's that trade-off between the two. I think you're very best to take the largest catheter that you're comfortable with, because then you'll get the advantages of the faster drainage, but without the discomfort. And for most people, that's somewhere between a 12 and a 16. 12, 14, 16 tend to be the popular sizes.
I know my go-to is the 14. That's my favorite one to start.
Bang in the middle. Yeah.
Yeah. It just seems the best. Let's see. Raj made a comment, the 14 or the 18 French, and just go easy. Can't argue there, Raj. I think it makes sense because it is going to drain quick. Sometimes these smaller ones that'll buckle too when you try to push them in. So
that's a great point, Vic. Yeah. And in fact, I mean, it's an old, urologist and urology nurse trick that if you're having trouble catheterizing, someone who doesn't know would think, oh, go for a smaller one. Actually, no, go for a bigger one, because that's probably not going to bug. It's going to find its way through. And so you're absolutely right. The smaller ones tend to be more likely to buckle. Again, a good reason for using a bigger one.
Yeah. So there's no doubt catheterization is an art form. You have to, practice it to learn what's the best way. My one thing that I really hate more than anything else is we do get some reps that come in with this bag of catheters, and they say, just give the patient the bag of catheters and tell them go home and figure out which one they like best, and then call us and we'll get whatever one they want. I think that's a terrible technique for teaching catheterization. We're the experts. We should be able to figure out what's going to be best, because there is plenty of catheters out there, lots of options, and one size doesn't fit everyone. As I mentioned, sometimes some of my elderly patients that don't have quite as good dexterity, the hydrophilics are just too slippery, so that if they can just put a little bit of lube on the tip of a non-coated catheter, they can work with it better. On the other hand, those slippery ones really have lubrication all throughout, so they go in much easier. So I think that the choice is really something that I would recommend, not leave it up to the rep who brings in a bag of catheters.
I totally agree with that. I think one of my pet peeves is when people do try and act like, oh, they're all the same and things. They're not all the same. If you think they're all the same, it means you don't know anything about them, and they have different properties. We've today, obviously, we focused on the technology, but you've mentioned issues about the size. There's whether you use a coude tip or not. There's whether you have a compact or not. I mean, you might, naively, you might think, oh, well, who wouldn't want a compact? Well, actually, even with a compact, there are trade-offs with that. So I think it's really important to have that range, and I think a Convatec, we're continuing to sort of broaden that and look at different aspects to meet. And to say, we focused on FeelClean Technology and gentle cath today, but we also have other catheters as well that we recommend in another portfolio, and which is our Cure portfolio, that we also recommend in certain situations. So I think you're absolutely right. It's horses for courses, as they say.
Yeah.
Yeah, and I've also found that many individuals use two different types of catheters. So when they're at home, they may use a closed system. When they're out and about, they may use a discrete, ready to use, or our compact cats. So it really just depends on lifestyle and whatever fits in with what's best for them. Yeah,
definitely. And I've even had some patients, some female patients, that they were having trouble teaching. I used a male catheter because the problem was the way they were built, it just wasn't long enough. They couldn't reach well enough. So you got to just kind of, be the leader for this to get patients to get a good result.
I think that's also a great point. And I think, depending on whether you're on a wheelchair and things like that, these things can also have a bearing on, what kind of length of catheter and things you would like. And actually, although we often call them male catheters, exactly as you say, that that there is definitely a use for them in women as well.
Yeah. Oh, fantastic. This has been a great discussion. I think it's really always good to have, if you're going to have a catheter-induced intermittent self-catheterization, having choices is important, and having all this technology really coming along. I've been, like I said, I've been doing this for 40 years. I mean, I can remember when we used to use red rubber catheters for intermittent catheterization. So I really go back, but these new ones are so much nicer. It makes, I think, lifestyle choices much better for patients to have these great options. So I thank you guys for coming on the show. It was, again, a fantastic talk. Really enjoyed talking about it. I've got a little clip for next week's show. Join us next week for this.
Vixenese explores the fundamentals of artificial intelligence, breaking down how it functions and its impact on healthcare. He explains that AI is a technology that enables machines to process information, recognize patterns, and make decisions, often mimicking human intelligence. Through algorithms and vast datasets, AI can analyze complex medical information, assist in diagnostics, and enhance patient care. He highlights how AI is already transforming our medicine by improving imaging interpretation, predicting patient outcomes, and personalizing treatment plans. Join us next week to learn more on UroNurse.
Yeah, so if you want to know more about AI, join us next week. This has been a real hotbed conversation lately. What does it do? Is it something that's good? Is it something bad? So I'm going to kind of cut through some of that information for you. Hey, be sure to stay with us if you want to learn more on our UroPatient podcast, which comes right after this one at 10:30. UroPatient's going to be talking about risk factors for bladder cancer. Are you at risk? And also join us on Tuesday night at 7 p.m. This Tuesday, Dr. Jeff's going to be talking with Suzanne Qualich, who's a specialist. Dr. Qualich specializes in male testosterone deficiency, and we're going to have an episode talking about testosterone deficiency. So join us for that. Again, I forgot one more slide I had here. Threw a new slide in here. If you want to find us for any of those episodes, go to our website. We've got links on UroNurse that takes you to Dr. Jeff's Sex Talk, UroPatient, and of course our audio podcast too. So with that, I'd like to thank everybody again for joining the show, and we'll see everybody next week.